So the CARD study is a very interesting study. It addresses an important point is, what do we do basically is quite in the third line setting. Patients were exposed to novel hormonal agents like abiraterone or enzalutamide. They were exposed to docetaxel chemotherapy. And then in the third line, what do we do? Do we go back to the other hormonal agent, or should we take the chemotherapeutic approach with a drug like cabazitaxel? And, you know, for the patients, many patients are attracted to getting a hormonally based therapy and avoiding more chemotherapy. What CARD showed us is that when we give them hormonal therapy again in the third line setting, these patients do very poorly. They progressed extremely rapidly. In less than 4 months, patients were already progressing radiographically, as opposed to with cabazitaxel, a chemotherapy-based regimen in the second line setting after docetaxel. These patients had significantly longer progression-free survivals. But what's very impressive is that their overall survivals were also very significantly prolonged compared to the patients who had this hormonal switch from one hormonal agent to another. So clearly, I think it puts it to rest that taking the soft approach really doesn't help patients, even in terms of quality of life, compared to giving them cabazitaxel if they've already failed first line novel hormonals plus chemotherapy like docetaxel.